One of the main causes of lung cancer is tobacco abuse, but generally any insult to the lung can be a trigger. It could be environmental, such as radon exposure, occupational, people may inhale chemicals or asbestos at work. There are genetic predispositions, and then anything that may impair the immune system, which is the normal surveillance mechanism of the body, can lead to the development of a lung cancer. Lung cancer can be a very insidious disease. By the time symptoms develop, such as coughing, chest pain, coughing up blood, the cancer is usually much more advanced. What we're trying to do is identify high-risk patients and do screening on them and find these tumors when they're less than a centimeter in size, so that they are, the goal is to find them when they're stage 0 or stage 1, which is a much different outcome than if you find them when they're stage 3 or 4. Lung cancer is diagnosed when an abnormality is seen on a chest x-ray, and then usually a CAT scan is obtained. We now use low-dose CT scanning as a screening mechanism. Once a nodule is identified and we're concerned about it, there are numerous imaging modalities that we use. One is PET-CT fusion scanning, where a CAT scan is obtained, and then we give a patient a radioactive sugar, which gets concentrated in rapidly dividing tissue, and we're able to then take where we see hot spots and superimpose it on the CAT scan, and we can see is that nodule metabolically more active than the surrounding tissue. If that's the case, we then are very concerned about that, and we may do either what's called a CT-guided biopsy, where using the CAT scanner, a needle can be passed from outside into the nodule. That's very good for peripheral lesions that are larger. We also do something called electromagnetic navigational bronchoscopy, which Holy Cross is one of the only institutions in the area that has this technology. And that allows us to steer to a nodule through the lung, similar to the way your GPS in your car works. And it's like driving through the CAT scan, and we create a three-dimensional CAT scan picture that we're able to utilize. And that has really revolutionized the ability to make an actual tissue diagnosis and then come up with a plan for what the right treatment is.